When we first began working on expanding the CAC model and figuring out what it was we were going to do, because we all knew it was a good model and it was something we wanted to implement, and Senator Malone, through his phenomenal capabilities, was able to access funds that would help it become a reality. We were in a meeting and Terry was there, and Senator Malone had not worked with her much, I mean, in pretty general terms, and so we were talking about some specific actions that we were feeling like needed to be taken, and Lisa McGee was there and a number of people. And we finished with the meeting, and Senator Malone and I walked out, and he said, "Man, she is so smart." And I certainly agreed with that, and he said, "We have got to keep her involved in this."
Dr. Kramer has been a great advocate for seeking the best practices for children in Arkansas. She has really dug deep and looked all across the United States and around the world for what the best practices are, seeking out the best professionals, and not seeing anything as being compromisable. And I really feel like that's been the biggest asset to Arkansas and children, is that she has not compromised on what we can do or how we can do it. She's always gone to the top and said, how are we going to make the best program that we can for children, the best mental health program with the best resources.
She is a model for collaboration. Terry seeks out people that can help better whatever it is that she's doing or involved in, or whatever program she's taking a look at. And so her ability to bring in people that are going to enhance that effort is just great, I think. I marvel at some of the things she's able to do.
When I think about Terry's work, especially through the ARBEST program, which is the Arkansas Building Effective Services for Trauma program, the things that stand out to me is, I think prior to that program being in place, which is around 2009, the availability of evidence-based treatments, which means the treatments we know work, for kids who have experienced trauma was pretty much none. So what we knew how to do is identify children who have experienced trauma, but then what, right? We don't want everyone to have to travel to Little Rock or to another major city in order to get the best quality of care. We now have therapists trained in almost every county, if not every county in our state, to provide a high quality of care to children in the communities in which they reside.
Dr. Kramer brought a shared vision by educating people across different partnerships. So she came in and she educated Children and Family Services employees, and not just one or two, but traveled the state and educated family service workers. She is the one who really got our employees and our caseworkers really thinking about trauma, and that was just kind of a kickoff to additional trainings, getting our children in therapy, and not just any therapy, but therapy that's focused on trauma. And then she didn't just go to us, she started training therapists across the state. And so when the training is consistent across the partnerships, across the different entities that are working with children, that creates a shared vision and shared value.
Dr. Kramer has made an enormous impact for the children and for the centers. When I began working at the Child Advocacy Center, it's about 9 years ago, and there was no mental health. I was the very first mental health counselor at our center. And we're in Hot Springs, we're a fairly large center. And I started out a day a week providing TFCBT and trauma care to the children and adolescents that we served. Today, we have 4 mental health counselors that work daily in helping the children.
You now have pieces of a mental health center in each of the CACs that work with Terry and the ARBEST program. So the ability to provide those support services is wonderful. I mean, You talk to anybody in the CAC and they will tell you what a godsend that is, that the ability to have that at such an accessible level has just been great.
Under Dr. Kramer's leadership, we have handed over for free, the program has for free, the tools equipped to deal with our most vulnerable clients. That's changed the landscape.
Before Dr. Kramer, people said the word trauma and they said our children are traumatized, but they didn't really know what that meant or how to help children. It wasn't until Dr. Kramer really started introducing and training therapists and training DCFS, and until she really came and said, we need to educate, we need to be looking for trauma. It was just a word in the dictionary. It really didn't have clear understanding, nor did we have a shared vision or value about what trauma is and how to heal from that trauma.
I really feel like Dr. Kramer could have gone anywhere in the United States and done a whole lot of different things in a broader spectrum than Little Rock, Arkansas, in a tiny state of Arkansas. But yet what she has done is she has promoted Arkansas child welfare, mental health services to one of the leading programs in the nation. I mean, she and the team created a program that has national recognition and as forefront leader, and that's what makes her an award recipient.
This honor is meant for people who go above and beyond to give of themselves for these vulnerable children.
I'm sure she never gives a thought about, well, are people going to know that I developed this and recognize what I've done? I think her heart and soul is in the profession and in providing the services that are going to make better the lives of those children.
She's kind of a behind-the-scenes lady. Every once in a while, she speaks, but really, she's not the one putting herself out there saying, look what I've done. But I think this is a great opportunity for us to recognize that she really has been a pioneer in this state, and she is the one who has brought awareness to all of us about trauma and really changed our system and how we serve these children and families.
She's not just satisfied with helping just a little bit. She wants the children to flourish, to heal, to help them recover their innocence so that they can be healthy adults who contribute as adults. And so for the children who have experienced, all the thousands of children who have experienced healing and wholeness, I don't even think we can measure the impact that Dr. Kramer has had on our state.